Hey, this is your friendly neighborhood paramedic, and this is another episode of Anatomy and Physiology in the Real World. And today we're going to be talking a little bit about what happens when you come to the emergency department. And specifically, I'm going to ask you for something. Depending on what your complaint is, if you got something really mild going on, I'm probably not going to ask you for this, but if you got anything else going on, I'm going to ask you for a urine sample. And you're going, well, why do you need a urine sample from me? Well, lots of reasons. So your urine tells me a lot about, number one, is your kidneys functioning properly, all right? Is it are their kidneys functioning properly? It could also let me know if you have any type of infection. You may have what's known as a urinary tract infection, and we can tell that by doing a urinalysis. One of the other things is we can check the osmolality of it, and I can see, are you overhydrated? Are you underhydrated? Are you needing IV fluids? And we can tell that from a urine sample. One of the other things that we can do is if you're experiencing complications from diabetes, or maybe you're coming in because you don't know you have diabetes, I can see if you are getting rid of glucose in your urine. We can see that as well. But one of the other things that I can see is maybe you came in and you're unresponsive, or maybe you're not acting right. Well, I can also see if you've been a naughty boy or a naughty girl and been using all kinds of different substances. We can tell that in your urine. Yes, we can. One of the other things is maybe you're coming in and you're having difficulty urinating. If that's the case, we can put in what's known as an indwelling catheter, which is a Foley catheter. We can put that in, and we can actually relieve a lot of that pressure where you're unable to urinate. One of the other things that we do in patients who are very ill is we're going to be able to look and see the amount of urine that's coming out, and we can tell what's known as intake and output on how much that you're getting out. Now, you should be getting out at the very minimum about 30 milliliters per hour. We'd really like you to have about 50. And so, I want you guys to understand, if you come to the emergency department, I'm going to ask you to pee. Have a great day. I hope you learned a little something about why we ask for a urine sample. And if you're ever in the ER, don't be surprised when a smiling paramedic comes in and asks you, hey, can you give me a urine sample? Have a great day, guys.